Hello, I'm Janaina Koenen. I'm an endocrinologist, and today I'm going to talk to you about ketogenic diet and its diverse applications in health and disease. The ketogenic diet, it's a very old approach. It's not like the fashion diet, it's not new. Everyone is doing it since the beginning of the century to treat epilepsy with great success. You know, before we had anti-epileptic drugs, the ketogenic diet was like a savior for all those children who were fasting to get rid of the seizures. And the ketogenic diet became a safe, efficient approach in which we can withdraw all medication in some cases and even cure the patients after a while. Fortunately or not, the industry came up with all these drugs and the ketogenic diet was forgotten. But now, you can see in the guidelines for refractory epilepsy, ketogenic diet is an option. I think it should be an option since the beginning, because if you have a chance of cure the child after 2 years of doing the ketogenic diet, why not, right? So, anyway, it's a very old approach, it's very safe, it's been done in kids, babies, right? And now, after a while, after refractory epilepsy of Charlie, it came back some time ago, and all the publications started rising again in PubMed, in Medline. Thanks God. And now we know, as a fact, and we have many papers about it, that ketogenic diet can be applied in a lot of diseases. For example, we can use a ketogenic diet to treat neurodegenerative diseases. The ketogenic diet is anti-inflammatory. The beta-hydroxybutyrate, butyrate, which is the ketone that goes to the brain, it's used by the neurons, and it's more efficient than glucose in terms of making ATP. So energetically, the beta-hydroxybutyrate is more efficient. The brain thrives on ketones. Patients improve condition. Patients improve energy levels, and even in Alzheimer's patients. It doesn't depend on how long you had it. So you can try the ketogenic diet in any Alzheimer's patient and see what happens. I usually give it a try of 3 months. I have some patients that respond really well. I like to think of Alzheimer's disease as a war scene, you know, like those paintings where you have the civil war after the fight. So you have dead people. There are lots of people on the ground, right? You have dead people. You have hurt people, like they were shot in the chest, so they're going to die like in 5 minutes. You have amputees that if you care for them for a while, they'll walk again with crutches and then maybe prostheses. They're not going to die. And you have people that are just passed out, but they're okay. They're going to wake up and go walking. So this is like Alzheimer's, right? You have neurons in an energetic crisis. They're not able to use glucose as energy because they're insulin resistant. That's why we call Alzheimer's type 3 diabetes, because the brain has insulin resistance up to a point in which there is a very, very harsh inflammatory response. And we have mitochondrial energy distress, right? So we don't have energy enough, the mitochondria don't work, and you have no way this brain, these neurons can use glucose. So what's going to happen then? What can they use instead? So then we have neurons that are dead. Okay, so you have Alzheimer's for a while now and they died. Nothing to do. It's like a stroke. There's nothing to do about it. That's why vascular dementia doesn't respond to a diet, because there's nothing to do. There's no one to save there, right? And then there are those neurons which are in very, very bad shape. But if you give them some time, they're going to work. So they respond a bit later, but they do respond. And those ones who are just beginning to get hungry and they're just waiting for something to feed them. So you come with a ketogenic diet and beta-hydroxybutyrate enters the cell without any problem. So there's no resistance to the ketogenic diet or to ketones. And then the neurons start working again. They have fuel. They can make energy out of it. So this has been published with exogenous ketones, right? We have ketone esters and ketone salts. And ketone esters are much better much more expensive as well. But that's a nice way of testing it. If you give ketone esters to an Alzheimer's patient for a while, for some days, maybe you'll see a response. So it's nice to get it a try. So I should go for it. I have lots of literature about it. I have some experience with Alzheimer's patients. I love it. I love to recover their mitochondria. I use phytotherapies, supplements, injected IV therapies, and diet. So it works really well. I like the RECODE protocol from Bredesen. If you don't know it, you have to read it. How to Reverse Alzheimer's Disease. You have to read that book. And his paper was published on aging. 2 papers explaining all the protocol and some clinical cases of his. So have Alzheimer's and also Parkinson's. So Parkinson's is a little bit different because we have a problem in the mitochondria. It's a structural one and complex one. And since it's a structural problem, not only a metabolic one, the diet doesn't work so well in every aspect. So usually we have the motor problems and the not motor ones, like dementia, like urinary incontinence, like other aspects of the disease that are not well controlled on levodopa. So the symptoms that levodopa doesn't help, don't work, right? Doesn't work. Ketogenic diet improves. So in Parkinson's patients, we can use lots of different supplements to improve mitochondrial function, like CoQ10, like curcumin in high doses, like glutathione and acetylcysteine, and other supplements that usually help mitochondria to work better. And we can do the ketogenic diet together with the treatment, the regular treatment, the mainstream treatment, to approach these symptoms that are not improved by levodopa. Okay? So Parkinson's, we have some trials on humans with very good results, but we have to talk about expectations, okay? So the motor problems don't respond so well to ketogenic diets, but the other ones, which are very life-limiting and that decrease quality of life, then ketogenic diet works very well, okay? So we have Parkinson's disease, we have MS with this multiple sclerosis, which is an autoimmune disease, and we have very nice papers published about ketogenic diet working well on it. Also high doses of vitamin D and other integrative therapies, naltrexone and other things like Viscom. I like working with many tools, many therapies of integrative medicine, and also mainstream medicine, because that's my background, to help the patient. Lateral sclerosis, ALS. There are some papers about it with the ketogenic diet with very good results. I haven't treated a patient yet, but I'm reading a lot about it recently. So it's nice to get it a try, to give it a shot. Well, if we leave the neurodegenerative diseases, we can go to mild dementia, which is the beginning of everything, right? So before you have Alzheimer's, like a diagnosis, you have mild dementia. It's like a slow, very mild cognitive decline. It begins at 40 years old. It's like pre-diabetes. When you have pre-diabetes and everyone tells you, oh, that's nothing, go to a gym, improve your workout, you know. So Alzheimer's begins like that at 40. You start forgetting stuff and no one really gives importance they should. And ketogenic diet helps a lot in these stages, like maybe it helps more. If you begin, the earlier you begin, the better, okay? When we talk about other diseases that the ketogenic diet can help, we can talk about migraines. So I'm very experienced in that one because I had complex migraines in my youth. I'm still young, but when I was younger. And I had very bad headaches. I had very bad migraines. I was always at the hospital. And as soon as I began ketogenic diet, I never, ever again had another crisis. That's why I'm so keen on ketogenic diet for migraines. Of course, I use curcumin and omega-3s. And I never ate gluten again because I found out later that I had non-celiac gluten intolerance, which made me study a lot about it too. And I see now that many patients are sick and feeling bad because they have this non-celiac gluten intolerance and they're misdiagnosed or never diagnosed, which is worse, and never treated. Well, So we have lots of studies with exogenous ketones and ketogenic diets on migraines. It's interesting if we do a therapeutic ketogenic diet, if you measure the GKI for these people, before you say it doesn't work, get them into deeper ketosis, like 1.8, 2.5 of ketones, like ketone levels, that's good. And GKI under 3, which is an index in which we measure the glucose levels and ketone levels. And you have these meters like Ketomojo, which is a glucometer you have in the US, which measures both. You have 2 strips, you measure glucose, ketones, and it calculates it for you. It's very easy. I use it a lot in cancer too. So which brings me to cancer. I'll record a video only for cancer and ketogenic diets because there's so much to talk about that I won't waste a whole video here because I'll steal all the attention to cancer. But the ketogenic diet is a very promising approach to treat cancer patients in every stage. And not only because it limits the amount of glucose available for cancer cells, but because of a lot of other reasons, which I'll discuss in another video with you. Ketogenic diet is very good for acne. And depending if you're doing the diet, even the bacteria that colonize your skin cells and are more present in people with acne, they change because of the diet. So insulin is a hormone that promotes proliferation. Insulin is a hormone that induces the oily skin. If you have polycystic ovary syndrome, it is another problem because the higher the insulin, the more acne and hirsutism you have. So you have beard, all hair in your face, acne, because your insulin is so rocket high, then your testosterone levels, the dihydrotestosterone rises. So the ketogenic diet tackles all these problems, right? And helps you deal with all of them at once because you lower inflammation, you lower insulin, and you inhibit an inflammasome called NLRP3, which is an inflammasome very, very expressed and active in many diseases, like gout also. So another disease ketogenic diet helps. There's this abstract of a conference in which the Atkins diet was the most effective one in humans treating gout. So everything against the dietary recommendations because they think if you eat purines, you'll have gout. Like if you eat beetroot, you get red, right? No. So if you eat fructose and if you drink a lot of alcohol and you have insulin resistance, then your uric acid goes up and you have gout. So it's very different from what we learn in college, right? But that's so. Other diseases like autoimmune diseases in general, right? The ketogenic diet can help you because it's anti-inflammatory. And if you do a clean paleo-ketogenic diet without grains and you treat your intestines and your leaky gut syndrome that is present in practically everyone with autoimmune diseases, right? Everything begins in the gut and ends in the gut. So you have to treat your gut first. I have a very, very good experience with ketogenic diets and autoimmune diseases. Also, we can use Viscum album, which is mistletoe, right? We can use high-dose vitamin D. We can use immune modulators like curcumin and other ones intravenously or intramuscularly. We do it in the clinic or orally. We can prescribe oral supplements. And endometriosis is another disease that it came later because I had adenomyosis, so I had to study about it a lot. I didn't agree much with the treatments they prescribed me, and I changed some stuff. I have this gynecologist, Cynthia Fonseca. She works with me, and she's an specialist in hormone implants. And she told me, okay, so we can do gestrinone for a while. Maybe it can help you. So we did that with my ketogenic diet and some supplements, and I'm rid of adenomyosis. I said, okay, so now we have to study this because it's very promising. And I did study it. I did apply it in many patients now with excellent results. So we do ozone, we do high-dose vitamin C and dichloroacetate in some patients, and some curcumin intravenously, and some other stuff, some other therapies with the ketogenic diet, and we have great results, which is a disease I think is so misunderstood by everyone. We'll talk about it in another video. So I think people are just neglecting a very painful disease. And has a lot of impact in women's lives and is present in 1 out of 10 women. and half of them don't even know they have it. So the ketogenic diet can help in fertility issues. So if you have polycystic ovary syndrome or endometriosis and you're on a ketogenic diet, it might help you to improve your fertility. Of course, some other things help too, some other supplements, hormone replacements, and we have a whole integrative view of the patient, endocrinological view, because I'm an endocrinologist. So of course I have all my background, my medical background as an internist, as an endocrinologist. And then we use all this information to look at the patient, individualize the treatment, and prescribe a protocol. It's long-term, of course. No one will cure a person in 2 days, and we can't promise anything, but we'll try to reduce inflammation, improve pain, and who knows, you might get rid of those implants, of endometriotic implants. Also, of course, obesity, right? You don't have to be in ketosis to lose weight. You don't. You can do a low-carb diet if you have insulin resistance, and fasting protocols, intermittent fasting, which is great. I love it. I have lots of experience with intermittent fasting. And it's great for you to lose weight. If you have diabetes, it's obvious a ketogenic diet is good for you with intermittent fasting. If you have steatosis, hepatic steatosis, non-fatty liver disease, non-alcoholic fatty liver disease, actually, sorry, non-alcoholic liver disease, ketogenic diet is excellent for you, especially if you do fasting, because it is caused by fructose, by sugar, excess refined carbs, and then all this fat accumulates in your liver. We're not prepared for this excess of fructose coming from the diet. And our body doesn't know what to do with it. So our liver is the only one who does something about the fructose, excess fructose, which is converting into fat, right? So if you have a patient with hepatic steatosis, put him on a ketogenic diet with intermittent fasting, and you tell me what happens, right? You just tell me what happens. Well, I think that's about it. If you have type 2 diabetes, obviously you have an insulin resistance, you have a glucose intolerance disease. So if you withdraw all the glucose, the excess carbohydrates from your diet, you can even reverse your disease if you have a good pancreas still. If your C-peptide is high, you can reverse diabetes. You can reverse pre-diabetes with a ketogenic diet. If you use insulin for a while, but your C-peptide is high, you can withdraw insulin with a ketogenic diet. So it's a very potent tool we can use in many diseases. Why not, right? People are afraid of saturated fat. I'm going to convince you. I'm going to show you the data. I'm going to show you the papers. You shouldn't worry about that, because the cholesterol in food doesn't become plaques in your arteries. The sugar does. If you eat sugar, if you oxidize your LDL, then you'll have atherosclerosis. Then you should worry about that. But not because you're eating avocado, olive oil, or bacon, especially if it's organic. Okay, so if you eat lots of processed meat, maybe you should worry about that because of other reasons. But if you eat organic meat and real food, not processed food, you shouldn't be worrying about that. You should be worrying more about the belly, the size of your belly. You should be worrying more about what you're eating of processed food, about your sugary drinks. That's what you should be worrying about. And remember what I said, the ketogenic diet is a very, very, very potent tool for many diseases, and the literature is growing. So don't be afraid. Study, look for it, read more. Don't believe in anything you hear without double checking, because people are afraid without a reason. Okay? See you.